Good morning once again and welcome back to the Morning Splash. I hope you're having a fantastic Monday morning. It's a great start to the week and I don't think it can get better than this. I know that for some people it's business as usual because you've been home and you're still home, so it doesn't feel much like a public holiday. It really is a public holiday, but for people like us who have been going to work, essential workers, if you have to stay home today, if you get to stay home today, then I'm sure that you're enjoying the time that you're spending at home with family or friends. Welcome back on the Morning Splash. I'm Ronke Giwa Onafuwa.
My name is Temitope Omole. Hope you're having an amazing Monday so far.
All right, so I know quite a number of people have said how they'd like to hear, something different from COVID-19, but I don't think this is the time to be in denial or stick our head in the sand like an ostrich would do. You want to get as much information as possible because even though you may feel like all that's happening with regards to COVID-19 may be distant to you, it's still real and it is still out there. And so we will do our best at Splash 105.5 FM, the integrity station, to make sure that we bring you all of the updates, all of the information, the real stories on COVID-19. And today I'm going to be having a quick, interesting conversation with someone from the Aliko Dangote Foundation. She actually is the managing director of the Aliko Dangote Foundation, coordinator of the Secretariat of CACOVID, the private sector-led coalition against COVID-19. She is Mrs. Zouera Youssoufou, and she's here on the line with me this morning. Good morning.
Good morning, Ronke. How are you?
I'm very well, thank you. Thank you very much for talking to us this morning.
Of course.
All right, so I
Thanks
already
for having me.
Thank you very much. So I already did say that you are the managing director, Aliko Dangote Foundation, and coordinator of the Secretariat of CACOVID, which is a private sector-led coalition against COVID-19. Tell us about this coalition of the private sector, Zouera.
Right. So good morning to everybody. Good morning to you, Ronke. CACOVID was born, I would say about 2 months ago, 2.5 months ago, when Alhaji Aliko Dangote and Herbert Wigwe were each on their own trying to come up with a COVID-19 strategy, decided to come together and join forces. So just to kind of give a bit of background on it, the Aliko Dangote Foundation had already been involved in fighting COVID-19 since the first case had happened. So we had already pledged support to the NCDC, and we had already started working with NCDC and had already started redeeming our pledge, giving them, bringing ambulances, paying for the IT system that supported surveillance of cases, etc. But then I just thought, look, we should do more because this looks like it's going to be serious as we're watching the news. We're
Absolutely,
watching TV.
The numbers rising.
The Dangote Group had already been involved in, really trying to prevent the group from being impacted by COVID-19, given that we have a lot of Chinese and foreign workers and contractors. So it had been something that we've been thinking about as a group since December, when the virus started hitting.
Okay.
But the coalition came together in March, and the idea was, look, let's get other people to join forces and let's see what we can do to support government. So
Absolutely.
That's how CACOVID was born.
And that's brilliant because quite a number of times we do depend on government, even though government does have, a place in making sure that, there's a lot going on. But we as the private sector also have to make sure that we're also doing something as well.
Absolutely. I mean, when in times like this, government can't do everything. We know this. So we all know this. Government cannot do everything. Yes. So we need to support. We need to find ways to help ourselves to make government's action more effective.
Absolutely.
So what we decided to do, is let's see how we can expand testing because we simply didn't have enough tests being done in Nigeria.
Yes.
Let's see how we can get more isolation centers because we knew we didn't have enough.
Yes.
Some states didn't have any.
Yes.
And then how can we also bring some food relief to people whose lives are going to be impacted by this virus? Because as we look at unemployment numbers and as the economic toll across the globe, we know that some of it is going to get to us. So how do we make sure that we are providing for the needy? So that's what CACOVID has been doing.
Fantastic. And when the news of COVID-19 initially broke, the fantastic thing about what you're doing is that you're not just throwing money at the situation. A lot of private organizations just donated monies that people were sort of skeptical about how it would be spent. So the fact that you're doing specific stuff with regards to COVID-19, what exactly are you doing?
Okay. So yes, the money doesn't go to government directly. That's not how it works. We procure everything ourselves and then we provide it. So to explain, for instance, on the isolation centers and medical equipment, we built 6 ourselves from scratch. There's one here in Lagos, which we're going to be handing over to Lagos State in the next week.
Wow.
And we've handed over the other 36. So we've done one in each of the states in Nigeria, either an actual isolation center or supported the state in expanding the capacity of their isolation center. And that literally means buying beds, buying medical equipment, buying PPEs, paying for training for the medical workers in those states, and making sure that they have the capacity to have isolation centers. So over the past few weeks, we've unveiled the 36 plus actually 37 CACOVID isolation centers. Some of them are, like I said, standalone. Some of them are existing structures that state had, but that needed more support or that needed to be transformed. So that one is, we literally bought the equipment, the beds, and we took everything to the state, helped them set it up, and gave it to them. And, this is now for them to run. In terms of testing supplies, we've paid for several labs. We've bought testing supplies from different companies globally, because the sourcing for supplies is a global, we're in a global marketplace, there's a global shortage, I would say. So companies like Roche, like Cepheid, who make specific cartridges, we went through the UN to place orders ourselves, which we pay for. They come in and then we distribute, and then they get distributed to the different labs around the country that do the testing. We also bought PCR machines. The PCR machines are the labs, the machines that are in the labs that do the actual testing. So we bought some of those also, with the supplies that go with it.
That's
so
fantastic.
The idea isn't let's just write a check and give it to government, but let's get it and give it
Find
to
out
government
what the problem
to manage.
really
So of course we're not lab people, we're not pharmacists, lab technicians. So the supplies go to NCDC, and then NCDC now manages where the supplies go throughout the country.
Fantastic, Zouera. Well done. I wanted to also ask with regards to communication. I think we're also falling short in that area, because there are people who still think that COVID-19 is not real. And I think it's not because they just do not believe, but we're not communicating it appropriately. So what are you doing as CACOVID to make sure you're communicating to the grassroots, for example, as well?
Right. So that's been a really big it's not a challenge, but it's been a lot of work trying to get the message around COVID everywhere. The reason is, if we just look at how the disease has been affecting us on the continent in Africa, it's been less deadly, right? It's been less, I would say, dramatic than how it looks on TV, in Italy or in the US, with, hundreds of, hundreds of thousands of people dying. Yes. So we don't have that. So it doesn't feel as real. The second thing is, Africans are particularly resilient, right? Like, we know this. We have a lot of other things that bother us. We have a lot of other diseases that kill us, and we have a lot of other challenges. And so COVID doesn't feel like the emergency that it actually is. And I think another thing is the measures that we're supposed to take to protect ourselves from COVID are sometimes difficult for us to implement in our context, right? So, things like isolation. It's a challenge to isolate in many
How do you tell someone who lives in
countries.
one bedroom?
Exactly, how do you do isolation? It's difficult to do that. But we can wash our hands. We can, provide solutions to help people, wipe down surfaces and stay a little bit away from each other. I know Lagos has done has been really advocating, even in public transportation, having people sit away from each other, wear masks. I think masks are something that everybody can do, and that we don't need to wear medical grade masks. Just the idea is to cover your face and mouth so that whether you have it or you don't, everybody's protecting themselves, against somebody who could potentially have it.
Absolutely.
So I think because we haven't seen the massive, scary data, but we do know that people have died of COVID, and people are still dying of
over
COVID.
200
and COVID
people.
is deadly for older people and for sick people and for people with underlying conditions, which a lot of our people have: diabetes, high blood pressure, cancer. People who have those problems have a harder time surviving COVID. So we really have to be careful. So in terms of us advocating on the communications front, we've been doing a lot. We have messages in all of our languages in Nigeria, on the radio, on TV, in the paper, on Instagram. We're starting a campaign of what we call quote-unquote town criers, to go to different markets and to really talk to people about what they can do to minimize their chances of getting the disease. So, there's still some work to do on that front. We have a big communications team that's been working very hard to make sure that this message gets out, that people should really be thinking about this, washing their hands, covering their faces, wear a mask when you're in public, when you're talking to somebody, wear a mask. The virus transmits from one person to the other through droplets. These droplets come from our nose and from our mouth. So this is just really basic information that everybody should have. But COVID is absolutely real. We've been more resistant to it in Africa than in other places, but it doesn't mean that it's not here and that it's not a problem.
Absolutely. Well, great job to CACOVID and other private organizations that are doing their bit. But wait, at the end of the day, we still have to sort of put pressure on government to do more. Do you think government is doing its best, or what can they do?
Yes. And they are working hard between the NCDC, the Presidential Task Force on COVID, Ministries of Health. I mean, everybody's been working in a coordinated manner, and we work with all these bodies. By the way, we're not doing our own effort on the side without them. We are absolutely working in collaboration with the existing structures. Otherwise, everybody's effort gets dispersed. It's really important that we work together in harmony with PTF, with NCDC, with the various labs, with the state ministries of health, with the Ministry of Health, to make sure that everything that we do is adding value to what's already happening on the ground.
Absolutely. Well done once again. I wish we had more time to talk to you. I hope we can have you back sometime again to tell us what you're up to and what you're doing.
Anytime, Ronke, anytime.
Thank you so much, Zouera, for your time. Have a lovely day.
Thanks, you too.
All right, bye-bye.